All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. You caught us here on the radio, but you can also catch us on Facebook, which I'm sharing right now, All County Healthcare's page. And I'm really excited this evening to bring back to the program Dr. Melanie Rosenblatt. She's a board-certified anesthesiologist and also board-certified in pain management and addiction medicine. So we're going to talk a little bit about pain management. We're going to get into the medical marijuana talk this evening and learn a little bit more about her and her practice, where she's on staff at, etc. So, Dr. Rosenblatt, welcome to the program. How are you doing this evening?
I'm doing great this evening. Thanks for having me.
And thank you for joining us. Just push that microphone a little closer to you. Yeah, I should have told you that before. I always was Joe Rogan say like a fist away, so I'm watching him. Anyways, it's Dr. Melanie Rosenblatt. Like I said, pain management is your medical specialty. You were on the program in January, and we kind of ran out of time, so I'm so glad you could join us today. I heard it through the grapevine. Let's get the breaking news out that you're opening a new office on Monday, April 1st. No fooling around there. It's April Fool's Day, but you're really opening an office. Correct me if I'm wrong, 450 West Hillsborough Boulevard, right around the corner here in Deerfield Beach. Tell us a little bit about that. That's exciting news.
That's amazing news. Yeah, we're really excited. We've kind of grown out of our space in Pompano, and I have another office in Boca, which we're going to keep. I'm going to maintain that office. That's doing really well. But the Pompano office is just too small, so we're moving up the road a little bit to Hillsborough. It's just east of 95. It's 4,000 square feet. We've got tons of space, and we've got so much going on. Can't wait.
That's better for us, you know, Palm Beach County residents, right around the corner.
Yeah.
And that is in Deerfield?
Deerfield Beach.
Okay,
yes.
Deerfield Beach. Tell us about your Boca office. I don't think we got to talk about that much last time.
So my Boca office is on Military Trail between Butts and Potomac. Near right by the post office, the banyan tree.
Okay, I know exactly where that is.
So it's just north of Glades, and Glades, of course, doesn't intersect Military, so everybody gets confused there. But it's there. It's right there.
I used to do food reviews at restaurants over there, and I would always get confused.
It's easy to get lost.
How come I can't get off here from 95?
Yeah. So there are little tricks like you going back
I
by
think
New York
Farmer's
Prime.
Table's over there, right? The world-famous vegan restaurant there.
Yep.
That's a great area in the heart of Boca Raton.
It's a great area, right? It's a great building. It's a Twin Lakes Professional Center. So the whole building's full of doctors and dentists, and it's a nice building, a nice professional center.
Nice and good parking there.
Yeah, good parking there. Hillsborough is a storefront, and it's right next door to the True Leave medical marijuana dispensary. So it's got a lot of frontage on the road on Hillsborough. So it's nice.
True Leave. There's one in Boynton. There's one there in the Hillsborough there. And they're popping up everywhere. Let's talk a little bit about medical marijuana, because it is in the news. The new governor, Ron DeSantis, recently made smokable medical marijuana legal. I think I got that right. I read all the stories. So is that kind of what happened?
So it's now smokable legal, and we're allowed to recommend that on the registry when we take on a medical marijuana patient. We enter the patient into the registry. You get a P number or a patient number, and then you have your card, and then the dispensary logs onto the website to see what your physician has recommended for you.
Okay, yeah, I normally get all this news. South Florida Hospital News does a paper on the backside there that they have this kind of a cannabis newspaper. So I'm learning a little bit there. But so when they say smokable medical marijuana, this is they say it in the news as the flower, but this is the bud of the plant.
Yeah.
That people can take home and whatever way they can smoke it.
Right.
To get the effects of the medical marijuana.
Right. Before that, people were still able to vape it.
Or I think they call it tincture, I read. Is it under the tongue, maybe?
Under the tongue, the oil, yeah.
Okay, so either way. But those options are still going to be available.
Those are still available, and the topical creams, there's still other.
That's right, because that's big with CBD.
Yeah.
But the interesting thing about these dispensaries is they actually use labs, third-party labs, to test their products. So they test their CBD, they test their medical marijuana. Okay, so, and then, but now that's a little different from all the CBD you see everywhere. It seems like everywhere, every green market, every place has CBD, every drugstore. But is all that really being tested is the question? Like, is that the right amount of CBD and everything? Are you getting any CBD in this? There's no kind of regulations on that yet.
Right.
So that's kind of interesting.
Right. So at a dispensary, you can get the CBD and THC ratio depending on how your physician recommends it.
Oh, okay.
So there's high THC products and low THC CBD.
I see.
So the THC is the psychoactive part of medical marijuana, and the CBD is the non-psychoactive that still has some very important and pain-relieving effects.
Oh, that's a great way of explaining it. I never thought of it like that. So the CBD, it affects the head. That's what some people don't want to do it or don't want to try it because they're afraid, it's going to affect the way I maybe talk or look or act. But that's the psychoactive side of it.
For those people that are concerned about those kind of effects, the psychoactive effects, I recommend the low THC product.
Okay.
So they get CBD with low THC.
So there's
and then as they become
everyone.
accustomed to it, just like you might increase a dose of of any medicine, you might increase the ratio of THC to CBD as they become accustomed to it.
Okay, that helps, definitely. Now, how does this whole medical marijuana thing work? Do I, if I'm interested in talking to a doctor like yourself, you offer this, pain management, board certified in pain management, that's who I'd want to talk to about this. Now, do I get an appointment at your office, and do you sit down and talk to the patient a little bit about what's bothering them and see if they fit the criteria? Because maybe not everyone fits the criteria, maybe everyone does. How does that work?
So there's a list of qualifying diagnoses, and if you qualify and if I or the physician you go see believes it might be helpful for you, it's important to have a conversation about the risks and benefits, the expectations, and whether or not you're a candidate, and start the process. And then within a few days you can have the medical marijuana card and you can go to the dispensary and get your product.
Okay, and then this is this a private pay system? Like, this isn't covered by insurance
This
yet,
is
right?
not covered by insurance.
Okay. And let me give out your info, because I'm sure people want to find out if they can become eligible or how that works. Again, it's rosenblattmd.com. You're now in Boca Raton, and as of Monday, right around the corner here, 450 West Hillsborough Boulevard in Deerfield Beach. How long have you been practicing pain management medicine in this area?
Are you gonna out me on my age?
I'm sorry. Did I do that to you last time too?
So I came down in 1995, straight out of my training in New York.
Not that.
So I'm from New York. I moved down here almost 24 years ago.
We have to ask you where in New York, because I'm sure we have some New York listeners.
Born in Brooklyn.
Oh, I see. It just came out there.
It comes out once in a while. Yeah, I got some Brooklyn in me.
Yeah. Well,
born in Brooklyn, raised on Long Island, went to medical school at Stony Brook, and trained up in Syracuse.
Oh, wow.
It was
very prestigious. Cold. Yeah, very cold up there.
Good basketball, except they just lost.
Yeah, Jim Byheim. I watched him growing up. I actually used to play a lot of basketball.
Oh, yeah.
What brought you to South Florida?
The weather. My parents. So my parents moved from Long Island, retired, moved down here in 91. So the day I started my residency in Syracuse in 91, they moved down to Florida, to Lighthouse Point, actually. So home is a plane ticket when you're a broke college student,
Yeah,
right?
definitely.
So I started coming home here, and I loved it. And when the time came, when I finished my residency, I was done with snow, done with the cold,
Yeah.
out of here, get me down to
Especially
Florida.
after Syracuse.
Right. Oh, yeah, Syracuse.
They get lake effect snow, or they just get heavy snow?
Tons of snow.
Yeah.
We call it Sibyracuse.
See, I'm originally from South Florida. I'm a native, and I'm always like looking in the wintertime, where can I go? Like, I want to get just buried in snow, but
Yeah.
it's not like that when you live in it every day.
I never knew any better. I just,
Yeah.
cold and snow and dismal
changing
and
the
gray was just
seasons.
the way it was.
Yeah. Well, we're happy to have you here in South Florida. And,
I'm so happy to be here.
shout out to Lighthouse Point. Boy, that's a beautiful area.
Yeah.
It really is. That's a gem of South Florida.
Yeah.
Definitely. So again, we're here with Dr. Melanie Rosenblatt. So you're board certified anesthesiologist. That's interesting. Pain management we know about, and addiction medicine. RosenblattMD.com, Boca Raton, and Deerfield Beach. Interesting thing there. Board certified anesthesiologist.
Yeah.
So you have that kind of background. Have you worked as an anesthesiologist as well too, or is that?
I worked full-time anesthesia for my first 5 years out of training. So from 1995 to 2000, I did exclusively anesthesia, and then some pain management within the anesthesia group, which is very difficult. It's difficult to do so many things at the same time.
I imagine. And that was at a hospital up in Syracuse?
No, that was down here.
Oh, down here.
Yeah,
Okay,
at
that's
Broward Health North. I was part of the anesthesia group there for 5 years, and then I left the group and went out on my own and opened my pain practice.
Nice. And you're also on staff. You're on staff at Broward Health North, so that's the main Broward Health.
Yeah.
And you were telling me before, Broward Health Imperial Point.
Yes.
I know exactly where that is. I used to work over there, Cypress Creek and Federal Highway.
Exactly.
And the other one was, I missed it.
Holy Cross Hospital.
Holy Cross, yeah, just there in Fort Lauderdale as
Yeah.
well. Again, 3 great hospitals as well.
So at the hospitals, I do pain consults. So if your physician who admits you to the hospital wants the expertise of a pain specialist, they can consult me. There are other pain docs around also. So I'll go in the morning and see pain consults, whoever I've been called on, whether they're post-operative pain or trauma or cancer pain, whatever kind of pain, and I'll meet that patient for the first time in the hospital. And also I do some of my surgeries in the hospital. So I do intrathecal pumps and spinal cord stimulators. And those are pain surgeries that really have changed so many lives.
Yeah, I was going to ask you about that. Let's start with intrathecal pump. Did I get that right?
You did.
Kinda.
You did.
What is that? Why would someone need that?
Well, for a couple of reasons. Intrathecal pumps are basically the size of a hockey puck, and they get implanted under the skin with a tube coming out from the pump that goes around to the back and enters into the spinal fluid.
Oh.
So it's computer operated, and it delivers continuous or intermittent doses of a medication. For pain, intrathecal pain pumps, the pump medicine would be an opiate, a narcotic like morphine, for example, and that would go through the pump and deliver it continuously into the spine where all the pain receptors live. And so it has a very, very impactful effect when it goes directly into the spine. So you need a much smaller dose when it's in the spine than you would, say, taking a pill or even getting an IV injection.
And that's someone who has like severe spine problems and pain.
It's a late resort kind of thing.
To kind of just
But it also works, and a lot of people don't know this, for spasticity from various illnesses, including stroke, paralysis, spinal cord injury, MS. A lot of people get spasticity and tightness, which is best described as like walking through molasses or trying to move your arm and it's stuck, and when it doesn't move. Baclofen in high doses, and particularly in the spine, can help release those the muscle spasms.
Rigidness. Yeah,
the rigidness.
I interviewed a person once. Yeah, that is a rough quality of life.
But it always bothers me when I meet somebody for the first time who would be a great candidate for intrathecal baclofen, and I'll ask, has anybody ever suggested this to you? And they've never heard of it. Now, in the age of Google, a lot of people know more now, but a lot of people still don't.
Yeah, they still need a professional like yourself, and that's RosenblattMD.com, 2 locations in Boca Raton and Deerfield Beach. Hold that thought. We're actually going to take our commercial. Believe it or not, we're already there. And on the other side, we'll talk to you a little bit about that spinal cord stimulator.
Okay.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Well, we're back already, and welcome back to the You and Your Doctor show. We're here with Dr. Melanie Rosenblatt, board-certified anesthesiologist, medical specialty pain management is what she's really known for in addiction medicine. Before the break, Dr. Rosenblatt, we were talking a little bit about, you explained the intrathecal pump, and then we didn't have enough time for that spinal cord stimulator. So tell us a little bit about that. I've never heard of such a thing, to be honest with you. This is like groundbreaking to me.
It's been around for decades.
Really?
Literally, yeah. So a spinal cord stimulator is a lead goes into the epidural space, much like a epidural labor might be placed. A lot of people are familiar with that.
I've seen it myself.
You said you're an 18-month-old, right?
Yeah.
So it's just like that. So it's not a terrifying procedure.
No.
The lead gets placed in the epidural space, and then the battery gets placed just next to it.
Okay.
In the back, the side of your low back.
You easily
reach it, right?
Yeah.
But you don't need to reach it except because it's all under the skin.
Well, easily hidden too.
Right, exactly. You don't see it, right?
Yeah.
We call it like I have some ladies still wear bikinis, and
Yeah.
we want to get the pumps low and like right in that
Definitely,
area.
yeah.
And
Especially in
the
South
stems.
Florida.
Right. And the stimulator gets recharged, so you want to be able to reach it sort of on the back of your hip. But what it does is it creates a current that overrides the pain signal and distracts your brain from perceiving the pain signal.
Isn't
So
that
it's
amazing?
really it's sort of magical when I see it happen. Some of the better indications for spinal cord stimulation are pain after surgery, called post-lumbar laminectomy syndrome or failed back syndrome. So when you have persistent pain after back surgery, you put these leads in, and it stops the pain from transmitting.
Until the body can heal itself.
Or sometimes in the cases that I see, it's not that the body has to still heal, it's that the patient has developed chronic pain. And that happens sometimes even after surgery, or with herniated discs or degenerative changes, or one of the better applications for spinal cord stimulation is CRIPS or RSD, causalgia, and most people don't know what that is until they experience it, and then they wish they never heard of it.
Yeah.
So you can have a very mild injury, let's say an ankle sprain or a fracture, and when the body tries to heal itself, the nervous system goes out of control, and you get intense swelling and color changes and mottling and hair growth and sweating and coldness and hotness, and the air blowing on it hurts, and the bed sheets touching your extremity hurt. And so we're talking about spinal cord stimulator. I could talk about RSD all night, but the spinal cord stimulator distracts and stops that pain signal from being transmitted. So
That's
there's
great.
there's so much more to pain management than just pills. And we hear all about pills. We've got an opioid crisis, all kinds of bad stuff in the news about people dying from opioids, people not being able to get their opioids because their doctor won't write it. Opioids are so front page right now, right? And
They are.
But there is so much that we can do in addition to medicines that work as well or better.
Yeah, you went right into my next question, because so today, as I was driving in, I'm listening to NPR, and they're talking about the opioid maker of OxyContin. Purdue Pharma has agreed to pay $270 million to settle a historic lawsuit brought by the Oklahoma Attorney General. People can look it up. It's on the front page of CNN. Now, I want to ask you, why are opioids so addictive? You talked a little bit about the way the brain works in the last few minutes, but What is it that opioids do to the brain to kind of mask that pain? Is that a good way of putting it or not?
Yeah, well, I've heard it described so many ways, and a lot of people even still have pain on opioids, but they feel like it's somebody else's pain. It just doesn't bother them as much. So, I mean, opioids work in so many ways. Attaching to the mu receptor helps with the pain, the actual pain. But there are so many other effects of opioids, and the many different opioids have different qualities. Some of them are more euphorogenic than others. So the really popular drugs, like Purdue's drug, oxycodone, the brand name is OxyContin. Oxycodone is a very powerful molecule. There's oxycodone, there's morphine, there's hydrocodone, there's hydromorphone. There's a lot of different kinds of opioids. And some of them are more euphorogenic than others. And what euphorogenic means is when it hits the brain, it gives you this generalized sense of well-being. So it makes you feel good. And that's from the dopamine release. Dopamine is a neurotransmitter in the brain. Just like sex and drugs and other rewards, you talked about rewards earlier.
Yeah.
The reward system, the brain's reward system is mostly dopamine. And so when you release this dopamine, you feel fantastic. It's just this release. And most people who are dependent on opioids say, well, I don't get that feeling. That's not why I take it. And that's true because after time, that goes away.
Yeah.
Right? So you get that less and less, and you need to maintain the opioid in your system because your body's become dependent on it. And when you take that away, when it goes away, when you have the absence of the drug that your body is now dependent on, you get a withdrawal syndrome, which is really unpleasant, doesn't even begin to describe it. Withdrawal is like having the flu. Think everything leaks. Your eyes run, your nose run, you're sneezing, you're vomiting, you've got diarrhea, you feel like you have the flu, aches and pains, terrible pain. There's a horrible experience.
Yeah, we see it in movies, and it's just, this looks horrible.
Dope sick, right.
Yeah.
And that happens with opioids. So staying on an opioid is fine, you maintain the status quo, but as soon as you run out or you move or your doctor stops prescribing, now you've got a different problem. You've got pain and a dependency problem. Dependency is not an evil thing. It's not, drug addicts. Dependency happens by staying on the medication for a period of time. That's just the science of the drug.
Because the body builds up that tolerance, and it's just going to take more to, get to that effect.
Right.
So that's why medical marijuana is important, how it's coming of age. Like, it seems like in a perfect time.
Medical marijuana is very interesting because there is some evidence that it can help with the withdrawal syndrome. So just the absence of the medication, if it can help with withdrawal, that's great. And it can also help with pain.
Definitely.
So it's got a lot of interesting, characteristics. Of course, there's still a lot we don't know about it. I've never been trained outside of the state course online. But I haven't trained on, because there isn't available, how to dose it, how to affect it, how to really...
I'm sure that a lot of people are going to be doing research the next few years, obviously. But if anyone has a question, I actually got your phone number ready this time, too. Dr. Rosenblatt, she'll talk to prospective patients, doctors, referrals.
Absolutely.
Referral sources. You can talk to a doctor consult if you're interested. I know we have doctors listening to this program. I see a few numbers on the website. I'm going to pick this one, and you tell me if I'm right or wrong. But 954-281-4393.
No.
Not the best one?
That one might work, but I don't know. That might be a back line.
How about 561-998-5100?
That'll work. That's the Boca number.
Okay, there's the Boca number.
The Deerfield number will be 954-941-5556.
Okay, I see it there.
And I've got an amazing phone system, so both phone numbers ring in both offices.
Okay, so once again, 561-998-5100. We'll give that out. RosenblattMD.com. There's a ton of info there. I see you're 4.78 out of 5 stars on there. That's great.
Not bad.
That's 23 reviews. That's more than you see on most doctors' websites, so that's pretty good. That's telling something.
We also have a Facebook page, Pain Management Strategies.
Okay, I'm going to go like that right now. That's great to know. We actually were live on Facebook, so thank you for sharing that. Pain Management Strategies on Facebook as well. Yeah, if you have any questions for Dr. Rosenblatt, you can give her a call at those numbers or connect with her, book an appointment, learn a little bit, if you qualify for any of the medical marijuana or pain management that Dr. Rosenblatt offers as well. Oh, we only have about 2 minutes, so hard to believe we've ripped through it all. We got through a little bit of everything. And you also do addiction medicine. That kind of goes...
Yes.
Hand in hand.
So we've got a minute left. Yeah, addiction medicine, getting people off of medications. There's a lot of ways to do that. Suboxone is medication-assisted treatment that works very well.
I've read about that to help people get off opioids. So that's important as well. Now, one more thing we have, I think, a minute left to explain. The 3-day rule. Tell us a little about that. I never knew anything about that.
Yeah, a lot of doctors still don't know about it. Like, it's currently the law that after surgery or any kind of acute pain, you sprain your ankle, your doctor can prescribe you a 3-day supply of pain medicine and no more. And there are some exceptions. There's a 7-day exception if your doctor can document the need for a 7-week supply. So that's a lot of documentation, a lot of paperwork, a lot of explaining to do on that. So the 3-day rule is a 3-day rule, and so they're starting to come. The state is starting to come after doctors who are prescribing more than 3 days, and doctors are starting to get scared. So a lot of patients are now caught in a spot where the doctors won't prescribe because they gave them 3 days, and now they're running out. You got to come find a pain specialist that can treat chronic pain, and we're here for you.
Thank you. Chronic pain, Dr. Rosenblatt's your doctor, rosenblattmd.com. We'll have to have you on in May or June. You're always welcome, and we'll have you back on, and we'll have a little bit more time to learn about all the great things you do.
Fantastic.
Thanks again, and we'll see you next time.
Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthy